Hey guys, today we are going to talk about the COPD, the chronic obstructive pulmonary disease. So, the COPD has two types, emphysema and chronic bronchitis. So, the COPD is mostly reversible, not like asthma, it could be reversed. So, it's irreversible. And first, we will talk about the emphysema and later we will talk about the chronic bronchitis. So let's go with the morphology. Morphology is permanent dilation of air space distal to terminal bronchiole. Respiratory bronchiole contain alveoli and alveoli duct. Due to due to destruction of the wall of elastic tissue. After After alveolar collapse during the expiration leads to air traps in the lungs, so that's why it build up a lot of pressure. So it becomes the collapsing of the alveoli and alveoli space. So you can see here it's one of the CT scan. I got it for you. Here you can see like a emphysema, collapsing of the alveoli. It's a chronic condition. So you can see it's really getting worse with the time. So etiology, how it's going to happen, the patient chronic smoking for 20 years, a pack, 20 years he's smoking a cigarette. So that's one of the things, etiology. And pathogenesis, we see like a WBCs, release, elastase, lysosomal enzymes. So what elastase lysosomal enzyme will disturb because of the smoking and leads to create an imbalance, and then this elastins started to kill their own alveoli. And classification, there are four classification for emphysema: centri, pan, distal, and irregular. The pan acinar, we'll see the proximal part of the respiratory bronchiole is affected. Pan acinar, we'll see the proximal distal part affected, and mostly you will see in children the emphysema because of pan acinar alpha 1 antitrypsin deficiency in children, because we will discuss about this later in details. So first you see like sometimes the children you will see the emphysema. Of course the children are not smoking cigarettes or anything, so why they have the emphysema? Because of the alpha 1 antitrypsin deficiency. And distal, like along with the lung fibrosis, irregular TB induced emphysema. The clinical features, we will see pink puffers, no cyanosis, use axillary muscles. They use a lot of muscles to get air inside to the lungs for inhale and exhale the air. And dyspnea, no cough, weight loss, low air inhale, and you will see the barrel shaped chest. That's a key point. Barrel shaped chest you're gonna see in COPD, and especially the type of emphysema. No bronchi. Investigations. Let's go with the investigation. You will see hyperinflated lungs, tubular heart. This is X-ray you will see here. Tubular heart, a lot of infiltration. You can see around here. Okay, this is emphysema. Now we will go with the chronic bronchitis. Chronic bronchitis, you will see persistent productive cough for consistive for 3 months for 2 years. So persistent cough you will see for 3 months to 2 years, especially with asthma, bronchitis, and are excluded. So you will see here, this is the condition. You will see the chronic bronchitis. Here is also emphysema and chronic bronchitis. So etiology, the chronic smoking for 10 years is less than emphysema, but it's 10 years. Pathogenesis, bronchial gland gets hypersecreted and hypertrophy leads to change bronchial wall. So with this pathogenesis, like I said before, the imbalance is gonna be created between the gland secretion. So it's gonna be hypersecretion or hypertrophy. Either change leads to damage the wall, bronchial wall, and bronchial wall is gonna do the permanent dilation of bronchioles. So the classification, let's see, the classification is simple chronic bronchitis, mucopurulent chronic bronchitis, and chronic asthmatic bronchitis. So here the three classification. The first is by induced by asthma, second induced by bacterial infection in pseudomonas, and second is a simple chronic bronchitis because of the smoking. So there are three classification we saw here, and now we'll go the clinical features. The blue blotters. Blue blotters, why? Because you will see the cyanosis with edema, right heart failure. You will see in the patient, and hyperjugular vein you're gonna see in the patient, and with the chronic productive cough is gonna be the chief complaint. The patient will come to the hospital and he will ask the doctor, I have a chronic chronic productive cough. So you will understand it's because it's got something wrong with this bronchitis or COPD. And then you will see dyspnea, wheezing sound, edema, low air entry, and plus bronchi sound. And investigation, you see the dirty lung. So you can see here, when you take the X-ray in the patient, you will see a lot of dust like structures. So this is the main investigation. Okay guys, this is COPD, emphysema, and chronic bronchitis. So that is for today. Stay in peace.